Hi, I'm Dr. Ron Kurzeka, and today's topic is bone injuries, or as I've titled a chapter in my book, strains, sprains, and fractures. So let's first talk about what a sprain is. A sprain is a partial or complete tear of a ligament, and a great example of that is something like an ankle sprain. So a sprain is a torn ligament. A strain, or S-T-R-A-I-N, is a torn muscle. So you may strain your shoulder muscle or your deltoid. That's called a muscle strain. A fracture or a break in the bone is the same thing. So a fracture means that the bone is broken, and in some cases this can cause serious damage to an artery or nerve which may be nearby. If you look in this next illustration, you'll see how a fracture of the humerus bone, or the bone of the upper arm, if it gets too close to the artery or nerve in that area, can actually cause damage to the artery or nerve, and this can sometimes cause lack of blood flow to the hand if it damages the artery, or some type of impairment of function if it damages the nerve. We also like to talk about whether a fracture is either in good position and lined up, or is it angulated. So the fracture may be nice and straight even though it's broken, or it may be angulated as you see in this x-ray. So keep in mind that a fracture and a break are the same, and that a fracture can either be in good position or it could be angulated. Now, what do you need to do as a parent to take care of a possible fracture? Some of the more serious fractures we worry about are fractures to the elbow, or right above the elbow, as we showed you in a prior illustration. So if your child were to have an elbow fracture or swelling to the elbow and you're not sure if there's a fracture, the best thing to do is get a nice pillow and wrap the pillow around both sides of the arm, and that'll support and splint the child's elbow at the same time. You can do the same thing for a wrist or forearm fracture, either using a pillow, or you can even use a thin phone book and kind of wrap it up, and then you can put some tape around it and splint the child's wrist. So know what to do in the event of an injury such as a fracture, or in some cases that might even be a dislocation, and know when to bring your child to the emergency room. The key thing you need to be aware of is any child who has an injury to a bone, and if you press on the bone and there's bony tenderness in some area, and certainly if there is significant swelling or any deformity, that certainly needs to be checked out. But what we mainly look for in more minor injuries is if there's bony tenderness in that area of the bone. So if there's bony tenderness and your child just fell off their bike or whatever, they need to be seen by a doctor and probably get an x-ray to see if there's a fracture. So thank you for watching. My name is Dr. Ron Kurzeka.